We're talking about scheduling your updated COVID vaccine. As you may have already heard, the new COVID vaccine has been updated for the 2023 to 2024 season. So this is different than the older COVID vaccines. This is a monovalent shot, and it's designed to protect against the newer COVID variants that are circulating right now. So it's sort of taken the place of the older shots. And you can get it if you haven't had any other COVID shot in the past 2 months. I think most people at this point probably won't have had one that recently. A lot of people are eligible for this, many people. And the CDC, the Centers for Disease Control and Prevention, recommend that everyone 6 months and older get an updated COVID-19 vaccine. For young children, they might need 2 or 3 doses depending on the brand, but for adults and older children, it's just 1 dose. Okay. This updated vaccine is especially life-saving for people who are 65 or older, are pregnant, if you have any sort of underlying health condition, or people with certain disabilities. So it's really important for everyone to get this updated shot, but especially people in those categories, because you want to minimize your risk of getting severe illness, minimize your risk of getting sick at all. It's really important. That's why we're talking about it today. So even if you've gotten, all your COVID shots in the past, even if you've gotten all of the boosters in the past, this is new and important for this coming season because the variations change as we go along. Okay, and some of you might have found, I found this, is that it's more difficult now to schedule the updated booster than it was to schedule a previous COVID shot. Part of that is because nationally we've moved to a privatized system of offering these vaccines, which means that if you have insurance, your insurance is paying for it, as opposed to there being this big sort of government program to make sure everybody gets it for free. If you have insurance, your insurance is paying for it. But if you're not insured, please do not let that stop you from accessing the vaccine. There's something called the Bridge Access Program, which makes the vaccine available to people who are uninsured. And many locations are participating in that Bridge Access Program. So you can actually search by locations where the vaccine is free for people who are uninsured. So please do not let that stop you from getting the vaccine. There are options for you. Also, be patient. So one of the things that I found in trying to schedule a vaccine appointment is, it's not necessarily that you'll be able to get something tomorrow or in the next couple of days. I had to go 2 weeks out. It takes a little waiting time sometimes. It's maybe a little further out than you would like it to be, but it's totally worth it. It's worth it to protect your health. So just hang in there. And once you get that appointment settled down, then you'll just know that you've got it scheduled for that day and you'll be set. Actually a much different process I found than the COVID shots in the past. One of the cool things about this is that at lots of vaccine locations, you can get your flu shot at the same time. So they'll offer the flu shot as well. Also, locations offer additional vaccines that you can get also. If they're offering them at the same time as the updated COVID shot, that means it's safe to get them all together like that. So there's the RSV vaccine, which some places will offer. That is suggested for people who are 60 plus, as well as infant shingles vaccine. So if you're 50 plus, if you're immunocompromised, that one you should note requires 2 doses. So you'd need to go back within 2 to 6 months to get your second dose, but that's a good one to get as well. And pneumonia. So for children under 5 and people who are 65 plus people who are immunocompromised, the pneumonia vaccine is something to consider. You'll see too on different providers, there might be a whole range of other vaccines that they offer as well. These are the big ones that the majority of places will offer in conjunction with the updated COVID shot. A lot of places do just the updated COVID shot and the flu shot, but these are the ones that are add-ons in more locations. If you are insured, double check that your insurance will cover all of the shots that you want to get. Insurance, I think, is required to cover the COVID-19 shot, the updated one, but just double check to make sure that your insurance will cover all the vaccinations that you get at one time. Okay, so how do you find somewhere to get vaccinated? The first place you want to start probably is if you have a primary healthcare provider, check with them to see if they have the vaccine and if they're offering it to their patients. There are a lot of, like I said, doctors' offices and health systems that have a limited supply of the vaccine and they're reserving it for their patients. It's probably the most straightforward thing to do is to first check with your healthcare provider if you have one. If they're not offering it, you have a number of other options. My healthcare provider wasn't offering it, so I had to go through some of these. If you are a current patient at New York Health and Hospitals, like Metropolitan, any of the hospitals that are part of that network, you can call their number here. It's 1-844-692-4692. They'll have you make a primary care appointment in order to get the COVID vaccine. And I think you can get your flu shot then too, but you do have to make a medical appointment in order to then get it. But if you're a current patient there, they do have a supply of vaccines that they're offering to their current patients. If neither of these apply to you, you can go to Vaccine Finder. So it's vaccinefinder.nyc.gov to find a pharmacy or other location near you that's providing the COVID shot. And that's what we're going to look at today. So if you need to use Vaccine Finder, I'm going to go through the steps to set up an appointment at a pharmacy. We're just going to use an example of a pharmacy so you can see how that process goes. So let's look at what you're going to do if you need to go to Vaccine Finder to make an appointment. A lot of the appointments that you'll see in here are pharmacies, and most every major pharmacy is offering the updated COVID shot. You may have used Vaccine Finder the last time around. It's similar to what it was in the past, but the process might be somewhat different because it's not just these sites that you can, walk up to or that are city run. It's mostly private pharmacies. So I just want to show you the steps you go through in order to make one of these appointments. Okay, so the first thing you want to do is open up your browser. So again, remember, browser is Google Chrome, Safari, Internet Explorer, whatever that is that you use to look at the internet. And go to vaccinefinder.nyc.gov. You're going to see a screen that looks like this. You're going to go ahead and type in the zip code, your zip code, to find locations that are near you. Once you've done that, once you've typed in your zip code, you may want to filter your results by the insurance options. So let's say, that we are uninsured and we're looking for a site that will give no cost for uninsured adults. So we're going to go here to this drop-down menu. You click where it says insurance. And, you can say accept insurance if you do have insurance. But if you don't have insurance, you can say no cost for uninsured adults. But it should only give you locations that are offering the shot for free if you're uninsured. So go ahead and check that off if that applies to you. All right, you can also filter your results by vaccine brand if that is important to you. There's 3 different brands that are available right now. They're pretty similar. You can filter by whether the location provides walk-ups. Just know that that is very rare right now. And I would double check any site that says that they provide walk-ups just to make sure that that is in fact true and up to date. Again, they're hard to find right now. And then you can check and see that the location is accessible to people with disabilities. So if that's essential to you, you can click on that. All right, so once you found a location that fits your criteria that's near you, you're going to go and click on schedule appointment. You'll see CVS in here, you'll see multiple locations like that. When you click on the schedule appointment button, what it's going to do is take you to that pharmacy or location's scheduling, their internal scheduling system. So it's going to take you over to Walgreens scheduling system, and we'll see that in just a second. What you want to do here, and you don't need to have a Walgreens login or anything like that. You can just do this. Anyone can do this just using your information. So it's going to take us here. It's going to ask us a couple of questions. So you'll enter your zip code, your date of birth, your email address, and your phone number. There's a little text box here asking if you agree to receive text messages about your appointment. I recommend doing that just because, it's good to get updated or reminded too about when your appointment will be, especially if it's a little in the future. It's not just tomorrow. One quick tip, and this is true, I think, for the CVS one as well. Try not to hit the back button on your phone while you're making these appointments, because sometimes it will take you all the way back to the beginning. So as much as possible, try and keep going forward or like clicking on where you want to be as opposed to just hitting the back button, because that can make it so you have to refill some of these fields, and that can be a pain and it can be frustrating. So just keep that in mind. I had to go through that a couple times before realizing that that was the issue. So once you put in that information, it's going to ask you what vaccines you want. Make sure if you're going to get the updated COVID shot, make sure you check off that. But then you can check off, like I said, you can add flu, you can add RSV, you can add pneumonia, shingles, whatever you are sort of qualified for. And again, if you have insurance, you want to make sure your insurance will cover that. Once you've done this, it seems like in the Dwayne Reed system, they're really promoting the pneumonia shot. So you might have something that pops up that says, do you want to add the pneumonia vaccine? And I think, if you're 65 plus, I think it is, you get some sort of like gift card or something from Walgreens. So, there's a kind of an incentive for that. You can do that or not, that's up to you. And if you get Medicare, the pneumonia shot is free for you. If you were someone who that and you have Medicare, worth it to just go ahead and get it, probably. And you get a $10 Walgreens cash reward. So then you're going to be shown the closest location to you. And you'll see up at the top, if you scrolled over here, you'll see they have the next couple of days up here. I think they have like 5 or 7 days. I think it's a week's worth of days up here. So just click through these days. All right. Yesterday I clicked for today, so Tuesday, and it says, based on the information provided, we don't have any available appointments within 25 miles of your location. Don't let that stop you. You have to go a couple days out, or maybe even a couple weeks out. It just means you need to go a little farther in the future. If you go through these days and you still are not seeing appointments available, what you want to do, and this took some trial and error on my part too, I didn't realize this for a while. You want to click on this calendar right here. So that will give you dates that are much farther out, that are more than a week out. And that might be really essential for you to find a time, because it might be booked up till then. So make sure you click on this calendar, and then you can click on individual dates in the future and see if there are times available. Try not to click the back button. That could take you back to a screen from before. Just keep clicking the calendar and selecting dates to see what's available. And so we went all the way up to the 30th, October 30th, okay, which is in the future, but we're nailing down a date. So you should see something like this on days that have available appointments. They'll have these time slots. So go ahead and pick what works for you. And once you've done that, click next. Then you'll just be asked to enter your name, your first name, your last name, gender, race, ethnicity. Gender, race, and ethnicity are apparently things that the CDC collects, says it's required. You have to enter something to move forward. So once you've done that, click next. And then just review that all the details are correct, that it's the location that you think it is. You have all the vaccines that you want on here, and go ahead and hit book appointment. And once you've done that, you should get an email that is telling you, is confirming your appointment. You should also get a text message. Look at that email, because it will tell you what to bring to the appointment. Generally, what they'll tell you is if you have insurance, to bring your insurance card, but it'll just give you further details about that. So just look at that email to make sure you're not missing anything, or you don't forget to bring anything to your appointment. And congratulations, you have made your appointment. You're taking a step towards staying healthy. So here's just some takeaway things to remember. Whether you're using Vaccine Finder, or whether you're getting your shot somewhere else, new COVID vaccine is recommended for everyone 6 months and older, and it protects you against new COVID variants. So it's important to get this one, even if you've gotten all the ones in the past. You can get other vaccines at the same time as your updated COVID vaccine. So take advantage of that and get whatever it is you need all at once, and then it'll just be done. If you have a healthcare provider, check with them first to see if they have vaccines available. If not, go to Vaccine Finder to schedule your appointment like we just went through. And at many locations, updated COVID vaccines are available for free to people without insurance. Again, don't let it stop you just because you don't have insurance. There's definitely ways for you to access this. Searching through Vaccine Finder, there are actually many locations that are participating in this bridge access program that makes it free to people who are uninsured. So again, don't let that hinder you from getting the vaccine.